Hello, my name is Giselle Espino. I'll be presenting alongside Jasmine, Jennifer, Aaliyah, and Haley, and our population is Fragile X syndrome. Fragile X syndrome, or FXS for short, is a genetic condition. That means it's something a person's born with and it's caused by a change in a gene on the X chromosome. Everyone has something in their body called chromosomes, which are like tiny instruction books. The X chromosome is one of those instruction books, and it helps control how our body grows and develops. In Fragile X, there's a small change in that instruction book, which can affect how the brain develops and how a child learns. It's actually the most common inherited cause of an intellectual disability. You'll often see it more in boys than girls because boys only have one X chromosome. There are some physical features that can be associated with Fragile X, especially as children get older. These might include things such as a longer face, a larger forehead, bigger ears, or more flexible joints. Some children may also have low muscle tone, which can affect things like posture and coordination. But beyond physical features, Fragile X mostly impacts how a child learns, communicates, and behaves. For example, children with Fragile X may have learning challenges that can range from mild to more significant. They may also show behaviors like difficulty paying attention, anxiety, or being very shy in social situations. You may also notice repetitive movements like hand flapping, especially when they're excited or overwhelmed. It's also important to know that many children with Fragile X, especially boys, may also meet the criteria for autism, so there can be some overlap in what you see in the classroom. Overall, every child with Fragile X is different, but understanding these common patterns can help us better support them in a school setting.
What we see and why it matters. Language profiles in education. Individuals with Fragile X syndrome present with delays across receptive, expressive, and social communication skills. A key pattern to understand is that receptive language is often much stronger than expressive language. So this can mean that students understand much more than they're actually able to communicate. This is important in the classroom because it can sometimes look like a student doesn't know the material, when in reality they're having a difficult time expressing their knowledge. Vocabulary is often a relative strength, so students may know many words or recognize concepts. However, they tend to have more difficulty with grammar, organizing sentences, and clearly expressing their ideas, especially in longer or more complex responses. For example, a student might give a short or incomplete answer even though they fully understand the question. You may also notice differences in their social communication skills. Students have a difficult time staying on topic, taking turns in conversation, or engaging in back and forth interactions. Repetitive language or returning to the same topic is also really common, and this is often not intentional but related to how they process and organize language. In terms of educational impact, these language differences can make it more difficult to follow multi-step directions or keep up with complex verbal instruction. This is especially true in fast-paced classroom settings where a lot of information is given verbally. Even when students understand the content, they struggle to express their thoughts during class discussions, answering open-ended questions, or even explaining their reasoning. Social communication challenges can also affect peer relationships and group work. So for instance, a student may want to participate, but they don't know how to enter a conversation or maintain it, which can sometimes be misunderstood by peers. Additionally, speech clarity may decrease in longer conversations, making it harder for others to understand them. Attention and anxiety can also play a role, especially in busy or unpredictable environments, and that can further impact their ability to engage and communicate effectively. So overall, it's important to recognize that these students often have the knowledge and understanding, but they need the support with processing language, organizing their thoughts, and expressing themselves in the classroom. Providing structure, visual supports, and extra processing time can make a difference in their success.
So next I wanted to talk to you a little bit about how we assess language, the procedures and the supports with that. There could be a number of different assessments that you might see, but these are three of the ones that I gathered just to give you a little bit more of an overview and like a little bit more information on what you might see. So the first one would be the clinical evaluation of language fundamentals, also known as, you might hear it as the SELF-5. So this is a really big assessment tool that SLPs use. And in this, we use this for school settings because of the standardized assessment. This allows us to understand if a child may qualify for speech services. And so this assessment is really important too, because I like the fact that it offers a parent, report. So that way we're kind of able to have our own assessments and own interactions with the child, but alongside we're also able to get your guys' input, the parents' input, and, just kind of get a whole complete picture of the child. I think that that's really important. And then the National Fragile X Foundation supports that having the assessment be led through the child is also really important. I see that across the board, but also especially with this, you may have a child who's coming in who may be hyperarousal. They may have anxiety. This is kind of all new. It could be a little overwhelming. So just really following the child's lead will allow us to not only build a relationship with them, but then we're also kind of able to see them get more comfortable with us and maybe open up with us a little bit, more. And then the next one that I would like to go to talk about would be a language sample. So sometimes those standardized tests, they kind of don't really allow us to see everything. So with a language sample, what we would be doing is just gathering a child's language through a more of a naturalistic environment. And what I mean by that is more of an environment where they're comfortable in. We are building a relationship with them at this point. We may have been with them for a little bit. We may have toys to make them feel a little bit more comfortable. So we're really able to see those real life communication skills. And then with this, if there's a needed support, we can always use a reward system. That could be across the board with any of the assessment tools that we use, but also with the language sample, because, we're able to have, okay, we're going to talk through this. And then after this, you can have like a token or a sticker or something like that, just to kind of help them work for something to and get more language out of them. And then last is going to be the Vineland Adaptive Behavior Scale, also known as the VABS-3. So this is a behavior assessment, which I think is important because, with behaviors that occur, there may be a time that those behaviors are actually a means of communication for them. They may be trying to get something across to you. And so really taking a look at these behaviors and kind of just digging deeper into like what those mean, I think is really important for a child. And during this, again, this can go across the board with any of these assessment tools, but really for this behavior scale, we can also use visual supports that kind of just show like, hey, this is when we're starting and this is when we're ending, just so they kind of can see it. It's a little, it's something maybe tangible like a board or something with some Velcro on it to say, hey, like this is what we're going to start with, but then we're going to finish at the end here, just so they're able to have that visual. And then I want to just address a few things that are very important, I would think, so that way we can get the best assessment possible of your child, is to always make sure that they're well rested, they're fed, they have all of their necessary, visual corrections such as glasses or contacts. And if they do use a communication device, to bring that in as well. And if they are taking any medication, to make sure that those medications have been taken beforehand. I think all of those things are super important just because we want to make sure that we get the best assessment and the best picture of your child and see what we can take, what steps are going to be needed to take, what next steps are going to be needed in order for us to help your child as best as we can.
For individuals with Fragile X syndrome, language intervention is most effective when it is functional, consistent, and embedded in everyday life. The first approach is parent-mediated intervention, which is supported by McDuffie in a spoken language intervention in school-age boys with Fragile X syndrome. This approach involves training caregivers to actively support language development during everyday interactions. Instead of therapy only happening in a clinical setting, parents become the primary facilitators of communication throughout the day. Strategies include modeling language, expanding on what the child says, and using prompts to encourage more complex communication. For example, if the child says boy run, the parent might expand that to the boy is running fast, or model a slightly longer phrase like the boy is running in the park. The caregiver might also pause expectantly after asking a question to give the child time to respond. This method embeds language learning into predictable, everyday routines, such as mealtime, bath time, or getting dressed. The goal is to create repeated, meaningful opportunities for communication within familiar contexts. For example, during snack time, a caregiver might hold up two options and model phrases like want crackers or more juice, encouraging the child to request items. During brushing teeth, the caregiver might say, brush, brush, or my turn, your turn, pausing to allow the child to imitate. These structured routines are especially beneficial for individuals with Fragile X because the predictability and repetition help reduce anxiety and support learning and participation. The third approach is using visual supports combined with pragmatic language intervention, also supported by Hoffman in Language and Fragile X. Visual supports include tools like visual schedules, picture symbols, or choice boards that make language more concrete and easier to understand. These supports can help individuals anticipate what is coming next, make choices, and follow directions. For example, a visual schedule might show the sequence of activities in a school day, helping reduce transition-related stress. At the same time, pragmatic language intervention focuses on improving social communication skills, such as turn-taking, initiating conversation, maintaining a topic, and understanding social cues. A clinician might use visuals like my turn and your turn cards during a game to support conversational exchanges, or provide visual reminders to help the individual stay on topic. This is important because individuals with Fragile X often experience challenges with social communication. Overall, these approaches focus on building language in meaningful, supportive contexts, while also addressing the unique learning and social communication needs associated with Fragile X syndrome.
So now we're going to talk about team-based care. So who SLPs work with in the treatment of Fragile X and why does it matter? So Fragile X syndrome requires an interdisciplinary approach to care. A lot of professions are involved, SLPs and physicians included, but two other professions that are commonly involved and work alongside SLPs are occupational therapists and psychologists or behavioral therapists. So what are their roles? Occupational therapists, they help the individuals develop skills for daily living and increasing their independence. This can include sensory processing, fine motor skills, self-regulation, and daily tasks. For psychologists or behavioral therapists, their role is to help patients with those behavioral challenges that they might be experiencing. So this can be attention, emotional dysregulation, social anxiety. It could be repetitive or disruptive behaviors or movements or patterns, and then some sensory issues. So how do these professions collaborate with SLPs in treating these patients? So for occupational therapists, they work alongside SLPs to help treat the communication and cognition, but also addressing that mobility, motor planning, and appropriate use of sensory tools that may be needed in the treatment sessions. And so the occupational therapists are able to provide input and knowledge about what can the patient handle physically. And then psychologists and behavioral therapists, they collaborate with SLPs and they help to connect behavior with what is the patient trying to communicate. So they determine the goal of the behavior and then they find a functional, appropriate alternative for those disruptive behaviors or challenges that they might be experiencing. So what is an interdisciplinary team and why is it important? This is a team-based approach where individuals from various professions collaborate to integrate their knowledge and share the burden of decision-making and create the best comprehensive care plan for the client. So this leads to better patient outcomes, fewer clinician-related errors, and increased efficiency for both the patient and the care team. Here are a couple additional community or support resources for the care and treatment of Fragile X syndrome. So the first one is from the National Fragile X Foundation. This is a webinar explaining that multi and interdisciplinary approach. in the treatment of Fragile X syndrome. You can just listen to each profession describe what they do and how they can help the client, and they answer a bunch of questions that, caregivers or loved ones might have about what each profession is doing to help their child or loved one. The next one is a Facebook support group. It's Fragile X Female Carrier Symptoms. This has over 4.5 thousand members, and it's created for individuals who are living with Fragile X to talk about issues relating to being a female carrier of this syndrome. And it just helps to encourage and share. It's a safe space to share medical resources. The National Fragile X Foundation also has a community support network. This is a local network of chapters, contacts, and support groups that connect families and individuals with professionals. And this just helps peers. It's just a peer-to-peer support group that has guidance from professionals, and it helps families access information that they might have and helps them connect to others who might be sharing in the same experience. The FRAXA Research Foundation is a nonprofit organization, and it aims to fund research grants and fellowships that look at not only various treatment methods, but also finding possibly a cure. And this just creates a network for families with children who are affected to get in contact with one another and maybe get some questions answered about Fragile X syndrome. And then the last one is our Fragile X World. So this provides families with research opportunities to learn strategies and feel more informed about Fragile X, and it contributes to future treatments. So they have events around the world to support and bring families together so that they can connect and share in this experience. Here are the references that we've used throughout the presentation, and thank you so much.